Dr. Buleni, you're muted.
You're still muted, Dr. Buleni. Bottom left.
Can you hear me now?
Yes, that's it. We can hear you.
Okay, sorry about that. As I was saying, I've been speaking to myself, welcoming you guys, welcoming you all the dentists. I'm going to welcome you again because I've been speaking to myself. Sorry about that. I was technology compromised for a moment. Today we're doing round 2 of our discussions with our senior dentist and also our junior dentist. I'm going to introduce all of them, and in the meantime, I'll allow them to also open up their videos. I'll start with Dr. Nathan, who's a general dentist with an interest in implantology, as well as digital and cosmetic dentistry. For the past 5 years, his passion for dentistry and particularly dental technology has driven him to spend countless hours developing these skills to make treatments more predictable and efficient. He's currently in private practice based in Melrose Arc in Rosebank, utilizing his craft to improve oral health, as well as to mentor young dentists who practice in the surrounding neighborhood. And then we have Dr. Naidu. Dr. Naidu graduated in 2016. She did her community service in Escort. She entered private practice in Devon. Since she worked in private practice in various areas in Devon, giving her opportunity to interact and treat in area of patients. She values continual education herself on various aspects of dentistry through doing hands-on courses, attending local and international online lectures, in-person and presentation and study clubs. She's an active member of SADA KZN branch, currently serving as the branch secretary in the National Youth Dental Council. She's passionate about giving back to the Devon community through dentistry by organizing and doing presentations, promoting oral health education, volunteering at various dental outreach programs. She believes in the important factor of paying it forward by supporting and uplifting younger dental colleagues entering the world of private practice to guide them on the path of success. Welcome to our younger dentist, and then we have our senior dentist. We have Dr. Makwakwa, who's a specialist in community service, a board member of the FDI Women in Dentistry Worldwide, chair of the Dental Committee of the Medical and Dental Board of the Health Professionals Councils of South Africa, that is HPCSA, has experience spanning over 20 years. She is currently a lecturer at Sifaho Mohato Health Sciences University in the Department of Community Dentistry, where she lectures both undergraduate and postgraduate students. She is also a South African Dental Association National Liaison Officer for the World Dental Federation, where she sees to the implementation of FDI projects such as the World Oral Health Day. Her work experience spans over 20 years and includes working in public, private, and mining sector. Working in these diverse sectors gave her insight into the challenges faced by dentists daily while attempting to deliver quality oral health care to their patients. Her passion and drive to be the part of these challenges faced by dentists prompted her to be active in all spheres of profession. She's a firm believer of principles that we need to be the change that we want to see. She's married with 3 children. And then we have Dr. Yanal. Hello? Okay. And then we have Dr. Yanal, who qualified in 1991, worked in Joburg, went back to Cape Town, established a practice in Long Beach Dental. Apart from being a family dentist, particularly in cosmetic dentistry and advanced restorative dentistry, as well as dentures fixed on implants and full dental rehabilitation. She has attended numerous implant and cosmetic dental courses, is an active member of the international team of implantology study group based in Switzerland, as well as South African Academy of Aesthetic Dentistry. She's also responsible for managing the Long Beach Dental, qualified with a degree in business administration from the University of Stellenbosch in 1998. Her interests include traveling, interior decor, and collecting wine and wine testing. And then we have Dr. Meyer. Dr. Meyer qualified as a dentist in 1984. Oh my God, imagine that. So we have wise people around here who have been here in the field for a long while. Since 1986, Dr. Meyer is in private practice in Bloemfontein as the principal dentist. He's joined by another dentist, oral hygienist in the practice. He appreciates latest technology and enjoying using his microscope. He served SADA for many years as a branch level and is currently serving SADA as a board member and the chairperson of the dental practice committee and the vice chairperson of the board. He's married with 2 children. And then we have Dr. Erasmus, if we can remember him from the last session.
A short version, please.
Yes, Dr. Erasmus qualified in 1986. He opened his practice in 1988 in Pretoria, Hatfield. He's still in the same practice. He employs full-time staff, 3 full dentists, oral hygienist, and dental assistant, and 4 admin members. So he's been a chairperson of SADA, a member of the private committee, a national treasurer, a SADA national president. The only thing that is missing, that's for him to be a secretary or a CEO, but he's done it all in SADA. So guys, we're in good hands and welcome to everyone. So the rule is that the junior dentist will ask the questions, and then the senior dentist, whoever feels comfortable, will answer the questions. And then anyone from our attendees who feel like they have a question, please write down your questions, then I'll read them in between. We can carry on. Doctors can start.
Okay, good evening to my fellow YDC committee members, senior colleagues, and our attendees for this evening. Firstly, I'd just like to thank SADA for allowing me the opportunity to participate in tonight's discussion. I can still remember how it felt to transition from dental school filled with quotas and the support of supervisors when treating patients to working in ComServe where resources were limited and primarily doing extractions, to entering the world of private practice, feeling a mix of excitement, a little fear, and being overwhelmed. So it's really great that a platform such as tonight's discussion has been created to guide our young colleagues into working in private practice. So for my first question tonight to our senior colleagues is, considering it can be overwhelming entering the world of private practice or even opening your own practice, if a young dentist following ComServe is interested in opening a practice, what steps or structures should they follow to put them on a path for success? It's open to any.
Can I start? I think, yes, dentistry is quite a overwhelming type of profession. You not just only have to be a good clinician, but you need to be a good business person that you run a business. And that is overwhelming. I think especially for the newly qualified dentist and someone that comes from ComServe, often with different experiences. I know I'm not so familiar with what happens in ComServe, but I've got an idea. So my personal suggestion is, and that's the way that I've started as well, is to identify a practice or try to get into a private practice that you would like to practice in, the way that you would like to practice. And then take your time to learn. First of all, learn your clinical skills and do them as best as you can, step for step, obviously, and then learn, tick them off as you go along, learn all the time in your clinical skills, and then develop business skills by looking at within the practice that you're working in, how does it work? How does their systems work? What works for them? What doesn't work? How you would do it differently, or what you would take home with you. And when you feel then that you will easily and quickly see that it's not as overwhelming as what you thought, or it is very overwhelming, but you will learn to go in where your clinical skills hasn't been well developed, and then to try to run a business as well is really, really difficult and might, in some cases, set yourself up for failure.
Thank you.
Thank you,
Dr.
Dr.
Welgemoot, I totally. Sorry, Dr. Makwakwa, are you going ahead? I'll go after you.
That's fine. How are you? Evening. I think today we're doing ladies first.
Yeah, you're
So
welcome.
thanks. Janelle, you're quite correct. It's very, very overwhelming. In fact, what research is showing is that there's a level of de-skilling that happens in the comm service here, because most of the ComServe dentists are actually only doing extractions. And they're lucky if they actually get an opportunity to take a radiograph or even do restorations. So it is very important that you make sure that your clinical skills, you go for CPD points, hand-on courses, and you go into a practice and you make sure that you really reskill yourself before even thinking of starting the private practice. But I think, Ian, you'll remind me, I think years ago, we actually had a nice booklet at SADA that actually outlined for the dentists exactly what they would have to do. Because I mean, going into private practice is indeed a business. So unlike with us, when we completed, the banks were running after us, giving us money. So for the young dentists, you would most probably have to have a business plan, have maybe a situation analysis of the type of practice that you're going to go into, look at the foot traffic, look at the income in that particular area. So I'll just give you some snippets and then give it over to Francois. But I think what's also important is the registration process, because right now you're registered as a com service dentist. So when you complete the 12 months, you have to make sure that you're registered in the independent practice category so you can practice. There's the HPCSA registration, I've spoken about it. You've got your board of healthcare funders that you need to register with, the companies and intellectual property commissions that you need to register for, whether you're going to be a solo practitioner or going to be a company. So you really, really need to do your research. And I'll end here when you open your business. So maybe Francois will come in and then say that after you open your business account, what else do you then have to look at?
I fully want to agree with what both the ladies said. What I would love to add to, I was thinking about this today. I was fortunate when we did our military service, similar to your comm service. For 2 years, I practiced in a military situation in the Caprivi Strip, where I lived for 14 months because my parents-in-law lived there. I had the opportunity, and I ran that practice as I would have done a private practice, and that made a big difference in my life. The fact that I didn't try and do as little as possible while on the border as such, but I ran it as a full practice, and I could walk into a practice later and fully practice it. I want to make the following suggestion, and I don't know whether it's possible or not, but when you're doing your comm service, resist the urge to get lazy and find yourself a dentist in your area. I have invited various ComServe dentists to come and visit me in my practice. I have not seen one yet. Come and discuss cases, come and look how we do it. So find yourself a dentist, and what Dr. Makwakwa said, what Janelle said, learn from them, discuss with them, stand behind them, look at what they do. I am sure you will find a dentist who is most willing to do that. So let your skills not go to whatever during ComServe, but keep your skills up and become part of that community of dentistry in your practice. So find a practice, if possible, where you are, and learn from them and discuss with them and hear and see what they do. I am sure there will be people willing to do that. So that's my 5 cents for this. Thank you.
And I think, Francois, at the same time, in the same token, also use your ComServe time to educate yourself further.
Absolutely.
So different from when Francois and myself and Dr. Erasmus has qualified. The world is your oyster. Education is just a button away on the internet. It wasn't the case for when we were. We had to learn from other dentists. Study groups was far and few between when we qualified. So you have got a lot of great advantages, some disadvantages regarding opening a practice and so on, but there's great learning opportunity for younger dentists now, and you can literally educate yourself far and wide, as big as what the globe is. And that's really amazing. And use that time, because you will never have that much time again to educate yourself.
Absolutely agree.
100%. I mean, we live in there's so much information. I always ask my students, what are you watching? What is in your ear? It has to be beneficial. So we could give you the stepwise, but if you actually just Google it, you're going to find it. But I think maybe you should also come in just to have a booklet that can assist to say you need to have a practice management software, because those are some of the things that you need. You will have to have staff, you'll be a boss, so there are contracts that you'll be entering into. So there are many frameworks that you really need to look at. You will have radiology equipment. So there's registrations that need to go with the radiology board. You'll be working with medical aids. So those are all the elements that you would really need to also look at.
And also what Dr. Erasmus, sorry.
No.
And also what I wanted to say is, do it in a planned way. So take time to get a strategy together. It's different for every single young dentist. I've had a few dentists through my practice. Over the last 30 years, I kind of pride myself of being a mentorship practice. And it's interesting for me to see how young dentists approach their career. You cannot go at it at a haphazard manner. You need to literally have a focus, a vision, and then find a strategy to make that vision come true. And then you go and get educated exactly in the direction that you want to go.
Yes, I think, and I'll put it very well there, that you have to have a strategy. I was also doing my national service in those days, like Dr. Meyer, and we did 2 years. In the last year, I was sitting here in Pretoria, so I literally had a year to plan my strategy. And so I went to the Pretoria City Council at that stage, where is a viable business developments taking place in the next 20 years. It was identified around the main campus of the University of Pretoria. So I thought long and hard, that was my strategy. I want to target students. So it's at that age group, I'm not going to go build up a family practice. And that's why I started working on that strategy. And it was very successful. It's a different approach, and someone who's opening a practice in a suburban area, a mother and a lot of children coming in. So it's more business people and students. So it's a higher age group that I attended to, but it worked well. But I mean, then you should focus on that if that's your target market, decide what do they want, what do they need, what will their demands be. It's going to be totally different than a mother with children. So work on that. So and it's like Janelle said, focus on that vision and get into that. You must just remember, like I said last week, you are the expert. Go for it. Thank you.
Absolutely. And I would also like to add that not everyone is cut up for private practice as well. As much as you might want to be in private practice, but probably be in as an associate or partnership. Don't just go for being the owner of the practice by yourself. You can start by being in partnership or just being an associate, and then you gather yourself up. Some people will just stay in the position of being an associate, and that's normal, and that's perfectly fine as well. You don't really have to be the owner of the practice. Just go with what works for you as well.
Yeah, I think Dr. Bellini is quite right. Sorry, Dr. Bellini is quite right. I think it's way more difficult today than it was 35 years ago when we started. It's not a bad idea to go and work for someone as a startup and take it from there, become an associate or a partner or whatever over a period of time.
And also, Dr. Buleni, you will see international, the trend of in dentistry is that there's a complete move away from the single man practice. It is not the wisest and best way of working. And also coming back to the way that we start, it is, like I said, I honestly think that to do things on your own in a single man practice is really going at it the hard way. You get strength in numbers, there's so much support in an associateship, or you can be a co-owner or anything like that. But yeah, internationally, the trend is moving away from single man practices.
Yes, absolutely. So while you're still in undergrad, to make friends, and then with your friends, you understand, okay, Dr. Erasmus is good in financial management. So if we partner together, he will handle the financial stuff. Dr. Yanal has strengths in this, so she'll focus on that. And then we work together and we succeed very well together.
And when Dr.
And let me
Erasmus,
just add, if you look at the landscape, we don't know the funding model that's going to be used in South Africa in the next 10 years. So if actually the NHI does become a reality, there will be a push for us to actually leave the solo practices and have group practices, because we'll have a catchment area. So it really is I think the better way to practice, because solo practice is actually very lonely at times.
and Dr. Makwakwa, with what you just said now, I think, and leading back to what Dr. Erasmus said earlier about looking at your environment and what kind of patients is in the direct area where you're practicing, it is very important to always consider your microenvironment, so that environment right around you. Then we need to look at the macro environment, political, economical, global development, and what happens in the world. And you always have to look at everything. That is how you do your strategic planning. And I think a good thing is always to focus in small increments. Like for me, in my 30 years plus of practicing, I've always had a 5-year plan. And when I look back at how my practice grew, it was in 5-year increments. I thought it was coincidental, but I think looking back, it was very much planned. Because in my own personal life and in my way that I've always done business, 5 years was a good time frame for me to plan something new or bigger and to move towards that goal vision.
Absolutely. And I'll also say for young dentists there who are wondering where can they get the contracts or the advice, always call SADA. SADA has all the information that you need. If you're looking for a mentor and you are scared to ask them yourself, I mean, ask SADA to be involved, and then they can request on your behalf. I'm sure something can be arranged for you. And then moving forward, I think we can ask Dr. Vermaak. Dr. Nathan, you can ask your question, please.
Thank you. Just want to start off by saying thank you for the opportunity to the YDC for giving the platform. Mentorship has always been something that has been pretty close to me since qualifying, mainly because I found there was a lack thereof. So just to start off my questions, I'll start off with a more light question. And each one of the senior dentists, goes along the lines of, if you have one piece of advice you can give yourself, if you could go back in time when you were in your final year of varsity, your comm service year or years, and in the first few years post-comm serve, what would that advice be for each one of those stages?
Nate, you made me think about that one. And I'm saying it a little bit tongue in the cheek. I was already married when I started practicing. And in our time, when we were final years, a guy from England came over, and he tried to get us to go over to England and practice there. And at that stage, my wife and I were almost scared. So what would I do differently? I would not listen to my wife, and I actually would have gone overseas for a few years. I wouldn't have stayed there, but I do believe that was probably the best time to go. So again, like you said, lighthearted. That's what I would have done, because when you are in practice, you start building something, and it's not easy to leave then at that stage. So that's my quick answer for that one.
Francois, you're on thin ice. But I think it's very honest.
By the way, sorry, that is off the point, but at the moment, my wife says we should have gone. So I'm allowed to say that one.
Oh, so I'm happy she was going with you, because that's what was going in my mind, that the bio, the last 2 lines. But for me, I think advice in final year, I wanted to run out of that school. I didn't want to see anybody. I didn't want to hear the word quota. I actually did dental therapy. So by the time I did my BDS, it was hurtful. I didn't want anything. So my advice to the final years would be create a mentor-mentee relationship with your lecturers. It is difficult, but just try, even if you can just get one, because you can always bounce off some ideas. Now it's easier because you've got WhatsApp, We've got emails. We didn't have emails in our time, I think. ComServe, in our time, we didn't earn a lot of money, you know, but you are earning quite a bit of money in ComServe. Save that money. Some people are moving from a very low base where their parents are giving them money to thousands on a monthly basis. So save money, it's going to assist you. And in first year, I would say do not struggle in silence. There is a lot of information out there that can assist you. So don't create an island around you.
Yeah, for me, I didn't have ComServe or like the men went to the army or anything like that. So I jumped immediately into private practice. I knew I wanted to, I loved clinical work. We had quotas in our final year and also couldn't wait just to finish dental school so that I can start working. And for me, I would say my biggest advice for the first year in private practice is to learn as much as you can. Start with small steps, get all the basics in place and do it well. You must be able to do good contacts, good composite fillings, get good anatomy, and show your patients what you're doing, but get the basics in place and then you start and build from there, expand your horizon with your knowledge and with your skills.
Yeah, I can just say, Janelle is correct, but you know, dentistry has almost become a speciality within a speciality. You can't be good in everything anymore. It's impossible. So a group practice with different people utilizing their strong points in like composites or orthodontic treatment, whatever. And I must say, luckily, I did that from the word beginning. I kind of, like Francia, I also spoke to someone in the UK and I actually took that same model and applied it in South Africa. I bought 4 practices immediately and I applied 16 people working for me and it paid off. And the one thing that I would have done differently is I would have actually and never compromised on the ethics and the quality of treatment. And I always got people that were better than me in maxillofacial surgery or orthodontics. I don't think I've ever done in the last 30 years one orthodontic case. So, and I still made it. So I'm not the top clinician in the world, but if you can delegate that correctly and a good business model, you know, then you can do it successfully. The one thing that I can give you advice on that I would have done differently is take that SARDOT code book and guidelines and learn 10 pages every week. You should know every code, every modifier, whatever descriptor in that book to do proper billing. Otherwise, you're not going to get the results that you need for your good clinical work that you're doing. You're not going to be financially rewarded. You're going to do work that you're not going to get paid for. So study that coding book. Thank you.
Cool. You guys are lucky. When I qualified, I wanted to go to the UK, but then I was told I have to work for 5 years before I can be accepted in the UK program. So I was stuck in community service. But then what I wish somebody could have told me or could have learned by then is that with the HPCSA CPD points, don't just do them just to acquire the 30 points or the 60 points that they want. Do them according to the skill you want to acquire. Check for CPD points on the things that you want to learn and improve on yourself. And then in opening up a practice, I wish I could have known how to vet the practice, not just buy the practice because it's on sale. And also if I were to open up my new practice on how to go about it, I've learned that it's better to just buy, especially with the equipment, if you're buying the softwares, if I can use the same sensor with the same panoramic radiograph and the same camera from the same company, it's much better to integrate everything in one system than to buy cheaper equipment from different companies. Now we have 5 different or 10 different softwares for different things for just one patient. So having one system from one, it may come up as more expensive, but it saves you in the long run because everything becomes integrated into one software. Also mentorship, because you don't know who to ask. I wish I could have had somebody who was able to mentor me or able to even tell me what is SADA doing, because I just knew that I have to register with SADA and HPCSA. but really I didn't understand what was going on back then. I could have been more involved in the startup branches when I was still young and get more information and communicate with my colleagues, which are seniors, who understood things better than being stuck on my own and didn't know what to do. I could have done a lot of things. I mean, there was so much. I was lost. By the time the 5 years was finished, I already had my practice, so I didn't go to the UK.
Yeah, I think learn from everyone. Sometimes it's the places where we don't even realize where we can learn from. When I started out, I learned a lot from the dentist. I worked for a fantastic dentist in Edenvale, Uli van Skalkwyk, but I learned, he was very busy, so I learned a lot from him, but I learned more from his dental assistant that worked for him for many years. I learned from the dental technician that works with other dentists and how to do a crown prep. And sometimes learning comes from strange angles. And then there are so many platforms to join. Later in my career, the biggest single change was a periodontist in Cape Town that phoned me up one day, and he said there's a new study platform and study group in South Africa, ITI. I joined them, and that just fast-tracked my skills to a higher level, and I could do more. And I started working with specialists, actually discussing cases with them. Dentistry, and I think the people in my experience over all the years is that dentists shares. There's very few dentists that's not prepared to share and to help and support their colleagues, even colleagues of our own age or younger dentists. It is a fantastic, and I'm proud that that's one of the characteristics of our industry that I really value and I'm proud of.
Awesome. I hope everybody's getting all these answers. I'm not seeing any questions from the Q&A. Is everybody still awake there, or you just logged in and then you left the laptop or the computer on? Please send your questions so that we can have the feedback that you are attending. And then we'll go back to Dr. Naidu. You can ask your next question.
You're muted.
Doctor, you're still muted.
Sorry, can you hear me now? Okay. In private, so my question is, with all the advances in dentistry, do you feel that the education currently provided at our dental schools adequately prepares one for private practice? What could be improved?
Okay, I'll take that one because it really did speak to me, because I'm at the institution, and when you look at the basic curriculum and the scope of practice, we're actually producing somebody who can do just the basic dentistry and some fixed removable prosthodontic work, some perio. But when you look at it, for instance, when I qualified, we knew that there were things called implants. So there has been such rapid advances in technology that the education and the national hours has not actually been able to keep up. So what is very, very important is to, number one, know what you are prepared to do, know your limitations, know the areas of your interest, know how you're going to upskill yourself. Because the challenge is when you now start very complex cases and you're not adequately, you don't have the adequate educational background, it is not within your scope of practice, it becomes a challenge. So you need to also make sure that when you get out there, you attend courses. I did, I think, a postgraduate diploma in clinical dentistry. And the reason I did it is because I saw that materials were actually changing. We were moving to new generation of material. And I had the trader telling me what material to buy or not. And I was like, no, I am the expert, like Ian has said. I should be the one selecting what materials I want to use. So you need to upskill yourself, upgrade yourself, so that you feel that you are competent in this area. And then you find that we have postgraduate diplomas that you can do. There are some institutions that will actually offer masters in dentistry in specific areas. So you need to find out what you're interested in and then go into the postgrad area, because in the undergrad curriculum, we actually don't have enough time to actually go through all of the advances in technologies that are there.
I agree with you. And like Dr. Erasmus said, and to remind us that dentistry is almost a speciality within a speciality. So, and once again, referring back to what is the international trends now, is the single man practice is a dying practice, and your bigger, larger practice where there's a multidisciplinary approach where everyone can do basic dentistry well, and every person in the practice then develop themselves in a field of their interest or speciality and has the network, which then enables the patient to get the best service or treatment from the best person to do the job. So no patient can come to a dentist. First of all, we cannot be everything for a patient. We cannot be the best in all the fields that dentistry and treatments that dentistry offers. So if we want to give the best to our patient, the multidisciplinary approach to dentistry is the best way of treating. That means that you've got different people that does the different areas of dentistry well, and you need to work within that network to give your patient the best. If you work in a network like that, you get clinical support from your networking partners, and you learn how each other work, and the patient at the end benefits greatest, and you can, like up your skills within your field of interest.
Absolutely. I have. You can proceed, Dr. Mayor.
Dr. Boleni, may I add to what Dr. Welgemuth said? I'm jealous of her being in that practice that everybody of us wants, a multi-practice where everybody does their thing. We do not have it where I work, unfortunately. But what we do have, you call us senior dentist, I find that I get referrals from junior dentists. And I was challenged the other day by somebody that said, but the patient that she wants to refer wants to know, why do you have to refer me? Why can't you do that yourself? And I told, that was an endodontic case, and I said, I think it's a very good dentist that refers a patient to a colleague that can potentially do something better. And that, I think, is what Dr. Welgemuth also said within her practice then, but even then without your practice. Do not be afraid, especially then specialists as well, if you have them around you. The best day in my practice was when I decided not to do wisdom teeth anymore, and refer everything to the specialist. It was so much less stress, and even orthodontics, just to be able to refer that. So work with your specialist, but also then find somebody in even a general dentist that might do something better of you, and then go and learn from him how to do that specific and discuss that case. But remember that a good dentist caring for his patients might want to refer. I do not do surgery because the surgeons do it much better than I do. So I refer surgery cases and other cases as well. So don't be scared to refer if you think somebody can do it better than you. But if it's the field that you want to get in, go and learn from them. Go and learn from them.
Thank you, Franz. So you just reminded me of the day when I decided I will never ever look for a mesiobuccal canal. It ends.
I'm unfortunately, I'm stuck there.
I will refer, but it's very important for a practitioner to actually make those decisions, and actually very early on, because already you know what you're good at and what you find very difficult. And if it's something that you're good at, you're still interested in, and you still need the skills, you can refer and follow your patient. I used to go to the maxillofacial oral specialist. I used to go to theater with him, and he was very, very happy to have me there to assist. So I think we come from a very good community that is really willing to assist us, if only we also stretch our hands. Thanks.
And multidisciplinary doesn't mean that we all have to be under the same roof. The thing with working multidisciplinary, or people that you refer to, first of all, is knowing your limitations. So if you know what you are good in and what you're not so good in, and working with specialists as well, you learn from the specialist what other dentists do. It's almost like they have got a broader base of knowledge that they can share with you for bigger type of cases as well. So yeah, it's just learning from each other and having that learning network.
Yes, I agree with what you said, and I just want to make one comment, and it's not a criticism. Maybe Dr. Makwak was more up to date with the curriculums these days. I could just say that in the last 35 years, between all the practices, I actually employed about 42 dentists over that period of time. So I can speak a little bit from that perspective over the last 10 years or so. You know, when we studied, the course was still 5.5 years, and now it's only 5 years. And you know, in those days, I got worried to leave in university. I was worried that I know enough. So yes, now they squeeze it into 5 years. So I must say I've picked up, I mean, even from our time, that two things: orthodontics. There's a big lack of knowledge from the young dentists. They do not know where to take that kind of decision, and then almost like there's a fear in them of exposing a pulp. So they would rather go and just do this big filling directly onto the pulp and not go for the exposure and do the emergency root canal. I can understand that, and it comes with experience. I agree that. But I think that is something to look at, but speak to your peers. I mean, and I did that. I went to any specialists and befriended them, and you will see all of them are very helpful. They will help you. They're really not that kind of attitude, they're going to turn you away. But I think that looking at the curriculums, that is something that I picked up at mostly in Pretoria University, where I came from. But maxillofacial, the guys come out, they're much better at surgery than me, removing anything. But those two, orthodontics, endodontics, I found to be a problem in the last 10 years or so.
Yeah, awesome. I see our colleagues are awake, so I have a number of questions. Question number one is: in the current climate, would you still recommend specializing to become orthodontist or maxillofacial surgeon or periodontist or prosthodontist?
Yes, I think there's always a place for a specialist. If it's your passion and you feel that one field of dentistry is particularly interesting to you, or that you feel passionate about, then I think you owe it to yourself to specialize in. Yes.
I think I agree. And just to add, now the competition is very high. So we actually have a lot of candidates who want to specialize. So if you really intend to specialize, you need to look at what are the prerequisites, what primaries you need to be doing. So go in, do your primaries, so that when you actually, the post comes up, you are actually at a better position to actually be the successful candidate. And I could not agree with Ian more with regards to the move from 5.5 to 5. I think we need to really do some research into that and see what impact has happened just because of the reduction of that 6 months.
If I could just add to that question, because being a young dentist and coming straight out of, I think, ComServe and coming to private practice, I just assumed, you know, I must be a general dentist for a few years and then I need to specialize because that's what everyone does and it's super important. But then I see there's so many amazing general dentists that we have in South Africa that's just doing amazing dentistry. So I don't think every young dentist should think, okay, the way to go is general dentistry for a few years and then go straight to specializing. You can be a general dentist and do some amazing dentistry and make a huge difference to the lives of your patients.
Absolutely, by attending a lot of also hands-on courses to improve your skills. I definitely agree. I think this question also goes hand in hand with the one that I asked. It says, will the speaker still choose dentistry if they had it all over again?
For me, yes, 100 times over. It is actually, even now that I'm getting older, and I enjoy it more than ever before. There's not a day, very few days in dentistry that I regret. Everyone gets days that you don't enjoy, but I think one should really make sure that your skills, that you are top of your game as far as your skills is concerned. Relax, enjoy patients, give them the best, enjoy the patients, and yeah, it's a fantastic job. I would choose it over again.
I would also choose it again. I think 100%. And I think as well, we need to be, we shouldn't really be myopic because there's so many opportunities in the profession. So you need to also, let's say maybe have a mentor and find out what else is there that you can actually do. And let me speak about private practice. It actually allows you, I'll speak from being a mother, to actually raise your kids, be able to have that flexibility to fetch them from school. So there are so many other things besides the clinical aspect that you can actually enjoy by having that particular practice. Allows you to be part of a community. You can do research, you can specialize. So that's the world is your oyster. You can still do it. I do understand that because maybe with the older dentists, the environment was very different. But the question is, if I had to do it again, would I do it? And I say, yes, I would.
Absolutely. But let me just add on what you were saying, Dr. Makwakwa. You know, besides being in private practice, you can also be a lecturer at the varsity. You can still work for the medical aid as well. If you feel like clinical part is not your thing, then you can be part of the SADA management team, or you can work for the medical aid, or you can work for HPCSA or BHF. You don't have to be clinical, you know, in terms of dentistry. There's just multiple platforms that you can be in as also as a dentist. Oh, and yes, I'll choose dentistry over again. Absolutely, I love it. Absolutely amazing. I enjoy it. I think I enjoy it more when I'm attending the international courses because it's much broader out there than it is in South Africa. And I believe that you have the capacity to grow as well, to be like the European or Americans. Yeah, and I love, okay, I realized that in the UK, it's in the top 5 recognized professions. So if you say you're a dentist, you get some respect. And I like that. It's quite nice.
Dr. Erasmus, will you go before I go?
Okay, I'll go. Yes, the thing I liked about the industry is, I must say, I am a group person. I like working with people and helping people and so forth. But I like the fact about the industry that I can be my own boss. I think I wouldn't have liked to work too much in a corporate structure. But I also always tell the dentists, don't ever sell yourself short. Because I actually did tell the one person of the one scheme one day, when we had a meeting, Sada had a meeting with him, and we spoke about where he came from, and he asked me these silly business questions, but you can clearly see he had no respect for my business acumen. And I kind of told him, listen, if I went in and did my MBA after I did my BCHD, I would have probably been your boss now at that medical aid. So don't sell yourself short, guys. You are smart enough to become a dentist. So you're smart enough to become a good business person as well in your own practice.
Yeah, and picking up on business there, and I agree with you there. Yes, I would do dentistry again. I actually love my work now more than ever. I like the creativity about it. There's a lot of things that irritates and frustrates us, but I definitely love it. But I think Dr. Welgemoed will agree with me. If you cannot be proud of the work you're doing, the quality of work you're doing, if you are not able to show the patient after you've done a simple MOD and you can show them, listen, these are the contacts, this is your marginal reach. So if you must be proud of what you're doing. And that unfortunately brings us to the remuneration that we're getting for our work that we do. And that is something that you will have to do at the early stage. We spoke about community dentists and what they earn. Now, Ian maybe can help me here, but I do believe that the community dentist most likely earns more than somebody that will work for somebody in a private practice the first few years. So when you start working, just realize it's a long-term plan. Don't expect to earn. Don't work for the money. Work for the pleasure of doing it. Definitely, you must work for the money, like Ian said, and you must be effective and whatever. But the fee structure of the practice that you are in might determine the quality of your work. And that's a tricky one that I'm touching now on. But you will enjoy dentistry if you are able to feel good about what you are doing and you are willing to brag about it with your colleague. If you feel proud in what you're doing, even if it's a simple MOD filling that you do. Ian was joking with me that I can't see, that's why I use a microscope before we started the meeting. But one of the major changes in my life was many, many years ago, I bought a camera. That was 25 years ago. It was still one of those cameras here. You had to go and develop the photos and you had to wait 2 weeks before you could show anybody. But buying the camera and being able to show a before and after, that was one of the best things that I did initially. And now with a microscope, with a live feed, with my colleagues standing behind me and seeing everything that I'm doing, being able to take pictures, buy yourself an intraoral camera when you're in a practice. Show the before, it's an amazing tool for diagnostics, and show the after. But the question was, would we do it again? Yes, I would, but you will have to be proud on the work you are doing. So pick something that you're good at and do it as well as you can and feel good about it. Thanks.
I agree with Francois. I think it's important to, first of all, and I come back to that it cannot happen haphazardly. You need to plan and have a vision of what type of dentist you want to be, what type of practice you want to be. Then you need to have the skill to back it. And once you've done that, and with that comes, like Dr. Meyer said, an investment in equipment and things that you need to be able to give that product to the patient. Once you've determined that, you can determine the value. And once you've got the value and you can show the patient what value they are buying, your business model is in place. And you will always have enough income to sustain your practice, because it does cost money and you need to have to reinvest not just in your skills, but also in your practice all the time. But showing the patients the value that they are getting in clinical photos, the before and afters, the intraoral camera is almost your most valuable piece of equipment, because that's how you sell it. But you can't sell good dentistry if you can't do good dentistry.
I think my favorite line was, do it right the first time. If you do it right the first time, you satisfy your patient. You do not need to be hiding behind the door. You don't need your receptionist to be saying you're not at work. And then you're making sure that actually you're not, by repeating procedures, you're actually losing money. So if you do it right, you are proud, patient satisfaction, and you will make money.
Absolutely. Yeah. I'm not sure if Dr. Nathan and Dr. Nadia are regretting being dentist. What's your take?
I just want to follow up what Dr. Makwakwa said. They do it right the first time. And I'm not sure if it's still on the same question, or we moved away more to a business approach of dentistry. But it's correct what she and Dr. Welcome had said. A simple thing like diagnostic, it's an X-ray. I mean, a simple way of checking yourself, whether you're doing, and remember the coding book is there to help you to do good dentistry. That book was compiled by experts and specialists and university people that do the teaching of dentistry. So that's why the codes was put there to assist you. And a simple way to check yourself is look at consultations, 8101. How many did you do? Let's say you only did like 20 in a month. Then if you show me your 8107 periapicals is only showing 4 or 5 x-rays, you did bad dentistry. Because it's not about making money. You can't make a proper diagnosis without the x-ray. So if you've done 20 consultations, you should have had at least about 80 8107s. And this is not about overexposure and radiation and all that. That is diagnostic tools to use. You can't make a diagnosis. You don't have x-ray vision. You're not going to pick up periapical lesions, failed root canal treatments, anything like that. So that's why I say, go to your coding book, study your coding book, know the rules, regulation, protocols of each scheme, and apply them. And that's how you're going to do good dentistry. Thanks.
And another angle to that as well is, which I find, especially in my experience with younger dentists that just came out of the dental school, is that one must change your mindset from one-tooth dentistry to whole mouth dentistry. And coming to the coding with Dr. Erasmus, if I don't know if we are going to talk about business, but one of the things that I use in my practice a lot is analyzing the codes per month per dentist, because if you are a dentist that do one-tooth dentistry, you will only have a lot of 8104s. You need to have 8101s. And then, I don't know, Dr. Erasmus, you know the codes better than I do, but there used to be a code 8120, which was treatment complete. It's a no-charge code. I don't know if it's in the book. Is it still there? But we use it in practice because you want to see, have all your treatments that you've actually planned, have they been completed? And then when you then look at your codes, and you can use your codes as a reporting of the type of profile that your practice has got. And that's very important. So if you stagnate and you're not getting anywhere, just look at what kind of coding you are charging. And then you'll see what type of practice you've got.
While we are regressing from the point, may I please add this as well? No, I'm regressing with you. When Marlies asked me about this webinar, I made a few notes if I had to say something. And the first note on the point on this that I made, we asked, all starts with a good examination. So building a private practice all starts with a good examination. You might have a patient walking in there with a pain, treat the pain. If you have time, while you're waiting for the anesthetic, take 2 bite wings, take 4 bite wings, take a pan, take whatever you need, but at least book that patient for a full examination sometime. That is good work that you do, and the patients will appreciate it if they are well looked after, even if they might just come in with this one problem. Definitely everything starts with a good examination, and then, like Dr. Velgemuth said, with finishing the job as well.
Okay, thank you so much, colleagues. I think we need to go to Dr. Nathan for his last question before I go back to the attendees' questions.
Thank you. So I was actually had this question jotted down, and it's actually interesting that when we were talking about mentorship earlier, that all the senior dentists were saying it's very approachable community, and it's very pretty much easy to find someone who's willing to share and impart some knowledge. But especially in my first few years post-qualification, I find it to be complete opposite of what I was experiencing. And I'll give a scenario of exactly what happened. And what happened was essentially at a CPD event, I can't remember which one it was, I just randomly approached a doctor that was more senior than myself, and I asked a very broad question, almost as to start a discussion, maybe to find a mentor and just to see if you can make a connection with another dentist. And the response I got was, if you're asking, you should probably not be doing it.
Sure.
So that's kind of the environment that I myself and some of my colleagues have experienced. And I know that a lot of times if you approach a more senior dentist directly, like phoning the practice, going to the practice and asking to do mentorship. But I think, a lot of the CPD events, it shouldn't just be about the points. It should be about making a connection with another person that you can potentially learn from or even potentially refer to. And scenarios like that put me off even approaching a more senior dentist. So I was wondering if you guys ever did experience something like that. And maybe if in those scenarios in the CPD event, maybe you could flip the roles and approach the younger dentist. And if you do, how do you go about doing it?
I think if you had that experience, it's very sad and disappointing, because I feel like, and I speak for myself and many of the colleagues that I work with, that we have got open arms and like Dr. Meyer said earlier, would invite and wouldn't mind any dentist coming and joining us, sitting in our case discussions. And it's probably not the dentist that's got the same kind of vision of a learning culture. A place to start would definitely be the different platforms like ITI, SADA events, and SAD. There are plenty of them where you can actually go face-to-face, because I find nowadays people don't want to go to face-to-face events. Face-to-face events, you mingle with other dentists, senior and younger dentists, and then you will quickly see who are the people that you can ask. And yeah, I haven't had the same experience, and it is a pity that you've had that. And it can be despondent because it will make you fearful of asking the next dentist. So I can understand that very much, yeah.
If I can maybe come in as well. I think it's actually very sad that it happened the way it happened. Have you noted I've just been load shed, but it's fine. Because when I started my private practice, it was actually a senior dentist who came to my practice and introduced herself to me. And we're still friends even today. But I think if I could really just answer your question, because our experiences are different. I did indicate that I worked at SADA. And there was a time when we looked at the demographic at SADA and people who were members of the association, we realized that the younger demographic was missing. And it was mainly the older dentists that were there. And that's why we actually started the Young Dentist Council, to say that we need to have young dentists within our fold, have them in different streams. I think we had the public sector, private sector. But one of the work streams that were there was actually a mentorship work stream, because we wanted to be very intentional with the mentorship within the association. So I think you might be the second cohort of the YDC, but those are some of the things that you really need to look at to say, you know what, this is what I experienced. How can we actually make it better for the other dentists? And let's be intentional about it. Maybe we need to ask dentists who wants to be a mentor, in what area, what are your areas of expertise? And then we link the dentists, the senior dentists, and the younger dentists. And I don't think you need only one mentor. You could actually want different mentors in different areas of expertise. You might want Dr. Erasmus to assist you with the financials, Janelle to assist you with the practice setup, multidisciplinary areas, Francois to assist you with other aspects. But I'm saying as senior dentists, we should really be more open, because I mean, the field is now yours. We're about to exit, and we would not want the profession to die.
And I think if a senior dentist is a little bit more open-minded about it, we have got a legacy to pass on to younger dentists in the interest of best treatment for our patients. So if you, at the end of it all, always put your patient first, it is our interest to make sure that the next generation of dentists has got the skills that our patients need. So any dentist that doesn't subscribe to something like this is short-sighted and is maybe, I don't want to criticize it too much, but really it's not in the best interest of our profession not to be there and lend a hand. And from my experience, I think, Nate or Dr. Vermaak, you asked the opposite. I have learned so much from younger dentists that has come through my practice over many years. And I think they have been, unfortunately, I don't think any one of them are listening, I wish they did. But I have learned a lot from them, and they have played a big part in motivating me and stimulating me to take on things that I might, technology for one, that I might not have, and the digital platforms and, all of that, digital workflow that I might not have taken on if it wasn't for them coming into my practice and kind of, wanting to go in that direction of dentistry. So it works both ways.
If I could just add, being a young dentist, if you would like to call it. So I found joining SADA and being able to network with other dentists or senior dentists, it gave me that confidence to approach them, because when you're a young dentist coming into private practice or in your province or in your area, you kind of feel a little bit intimidated to approach senior colleagues, because you feel, well, maybe you're just going to be a nuisance, or they don't really want to deal with this young person chatting them up. But once you start going to the events or you go to the meetings and you start talking to them, they are willing to offer advice and help, and they would say, come to my practice and things. And also going to courses, I found, like, you go and speak to the people who are hosting the courses and you tell them, I have an interest in a certain field, for example, implants. They're always willing to say, I have a colleague who works in this province where you are, say you're coming from Durban and you're going to Johannesburg or Cape Town, I know somebody in Durban or Cape Town who's willing to, you know, mentor, and they would give you that contact number and you contact that person and they're more than willing. I've had that experience. They're more than willing to open their doors to you and, you know, assist you and guide you. And you tell them specifically like what you're interested in and, you know, what you need help in, and they want to see you, you know, succeed. So there is that option. Because I, for many years, was wondering, how do you get a mentor? Because I would go to courses and people would say, oh, I have a mentor and they showed me how to do this. And I'm thinking to myself, okay, where do I find this fairy godmother or godfather? How does it work? And it just took some time and speaking to people, and that's what really helped.
Identify a practice close to your practice where you admire and then make a connection with them. In my case, I'm sure you know, many of you know him, there's a dentist that practiced in Hart Bay, and that was about Dr. Andy Efting. And when I was a very young dentist, his practice looked to me like this is the practice I would one day want to be. So for many years, I just emulated and copied what he did. I went and he taught me a lot. And very few dentists will turn their back, especially if you give them the compliment that you think that they are a person worthy of mentorship. That's a compliment for any dentist. And like I said, we will gladly help younger dentists. It's a pleasure of sharing knowledge.
Yeah. On my side, I never had a bad experience. The mentor that I got was just open to me. I have a comment on the question and answer on the questions here on the platform. The doctor is saying, Dr. Permak's experience is unfortunate. I teach undergraduate students and I always counsel our students to find mentoring group after graduation, senior dentist, peers, or even keep in touch with any supervisors or lecturers who they are comfortable with. My own experience when I was a young dentist was when the opposite to his, where I had many experienced dentists and mentors who I learned from and accelerated my own clinical skills. So it was just that unfortunate experience for Dr. Fermat.
My apologies if I'm back. I was interrupted by load shedding, so I missed a few remarks. May I just add quickly, when I was young, there was orthodontist in Bloemfontein, Dr. Herman Reinach, and he invited us all to bring our study models, and he can show us what we must do to the patient. He will teach us how to do the Beck type orthodontic treatment at that stage. And we asked him the question, but why are you doing this? Well, aren't you taking work away from yourself? He said, no, the more I teach you what you must do, you will learn what you cannot do, and you will refer those patients to me, and I will have even more work than before. A rising tide lifts all ships. So I really believe, I'm unfortunate your experience, but I hopefully believe that there's the goodwill is in the majority outside there.
Absolutely. I have another question from the panelists, from the attendees. This doctor is asking, how do we find and hire a bookkeeper or an accountant to help you set up a practice or a business? What questions do you ask them? What interviews do you do actually here?
Maybe I can share my experience as a young dentist. So in our final year, we had a group of accountants that came to the university, introduced themselves, and they were well known in the medical and dental industry. And I looked at them and I thought I would never be able to afford them. When I started my own practice, I got an accountant, and after a few years, I realized I wasn't in good hands. And eventually I went back to the original accountant that I thought that I couldn't afford. And 30 years later, he's still my accountant, but not just my accountant, also like my financial advisor, also in a way mentor in business. And whenever I have got any challenges or difficulties, he helps me. So my message regarding that is you need to identify or get an accountant that comes highly recommended. So ask around. And then that is a lifelong or a career-long relationship, because the accountant will get to know everything about you, the way you do business, your attitude and philosophy regarding money, how you spend it, how you make it. And it is a relationship that is an asset. So I would say once again, get very good advice and recommendations from people that you trust regarding accountant. And it's for me, it's a one person, not necessarily a company that you go to where you're just a number. This is a very important relationship in any business.
I think it's a good idea to ask around from other dentists, who are the accountants and are they happy with that accountant? Because it's very different to run a dental practice as a business than running a hot dog stall or something where you sell a product, because you're selling a service. So it's quite different. So it takes a special type of accountant to do your books and do it right and help you. So ask around. That's how I got hold of my accountant, and I'm still using the same one after 30 years.
Yeah.
I think she's doing about 23 or 24 dentist practice. So ask around.
Absolutely. It's all about a relationship, build relationships. As much as you build relationship with your technician, your lab work, you build relationship also with your accountant. I'll move on to the next question, which is asking, if you are working in public sector for a number of years, would it be wise to leave? And how would you navigate into private sector? If I may start, I would say, leave because you want to, not because everybody's just doing it. There must be something that you really want to do. And you should have worked with other dentists, either as a locum or visiting dentists for some time, and check yourself if you are capable for the private practice, because it's completely different from the private sector as well. So it must be something that you really want for yourself, not just because everybody's doing it or because there's probably better money there. No, it must be something that you want. And that's my 2 cents worth of advice.
If I could add to that, so when I was in ComServe, my supervisor, she was in government for many years in the public sector, and we had a conversation about whether I should go into private practice or go into the public sector. Like, what would my options be? Why would I choose either one? And she told me, like, the best way to look at it is what's fulfilling for you. Like, she realized at some point after our conversation that being in the public sector just wasn't as fulfilling as she would think being in private practice. And I spoken to her recently, and she says, you know what, I'm so glad I made the change, because she just finds being in that private practice environment is a lot more fulfilling for her, because unfortunately at the establishment where she was just doing extractions all day, every day. There wasn't any other type of dentistry that she was doing. And I mean, she studied for 5 years, learning about different aspects of dentistry, and she just wasn't practicing it. She just felt she lost her love and her interest for dentistry. But once she made that transition, she felt fulfilled and she started enjoying what she was doing. And it affected her not just professionally, but personally as well. So I think that's something to consider.
Absolutely. I mean, I think once you've identified if you really want it for yourself, therefore then check in what form are you going to be in the private practice. Are you going to be a solo dentist? Are you going to be in partnership? Are you going to be an associate? Which one is going to work best for you? It's all about the fulfillment at the end of it.
Yeah, I think, and it's also, I mean, it's not a decision that one makes lightly, because it's a directional change in your career, and you need to prepare yourself well before you take the step.
I think maybe what I'll say is, I mean, if you are in private in public and working in the public sector, we actually know that the services that they provide are mainly minor oral surgery. So if you actually have a vision, or you haven't decided that you're going to spend the rest of your life in the sector, you should be keeping up with your clinical competencies, meaning that at some stage you should then still be doing your locums. If you're not doing it on a monetary basis, you still should be engaging with your colleagues in the private sector and make sure that you're keeping up your skills, because you're actually doing it for yourself, so that should there be a need for you to transition into the private sector, you still know that you have the clinical competencies. Because now we're finding that some clinicians stay in the public sector, not because they want to, but now they're scared. I haven't done a full in 5 years. I haven't taken an impression in this period. So there is that fear factor. So always make sure that you keep up your skills and competencies, and it opens up your horizons.
Okay, if we don't have any more answers, I have another question from our dentist. The question is, do you think that Airway dentistry should be included in the undergraduate's dental curriculum so that the patients can be scanned holistically to rule out sleep and breathing problems?
This is, I think this is quite similar to the question that was asked earlier. And I think the response we gave was with regard to the scope of practice of the dentist and with regard to how the curricula is structured with the national hours, to say that at the end of the day, this is the outcome that we require as a dentist. And what we're seeing now, as we said, is that with advances in technology, with advances in different disciplines and areas, we're finding that there is a pressure to increase the undergraduate curriculum, which becomes a challenge because as it is, we don't have enough time to teach the basic curricula that we need to be teaching. So I will again say that if you have a particular interest, I mean, it reminds you as what Ian was saying earlier, that dentistry is actually becoming a specialist within a specialist. So if you have completed and you have an area of interest that you want to be upskilling yourself in, then you need to either go the academic route, do your specialization, but you need to make sure that you have the right skills, competencies to perform any procedure that you want to do, just so that if in case there's malpractice, you're not found wanting.
I mean, on what you just said, Dr. Makakwa, can we then consider having back to 5.5 years or 6 years instead of the 5 years?
Mbega, I've thought about it because I had the 5.5, and this is really from a personal perspective because we haven't gone into that research. But I did the 5.5, and I was still overwhelmed. I still left the dental school not feeling that I had learned everything that I had to learn. So I think we actually need to go back, do some more research and find out whether, I mean, after some time, you should be reviewing policy, reviewing any changes that have happened to see that did they have a positive outcome or a negative outcome. There's nothing wrong in saying that we moved or diverted in this way, but actually we should not have. So that's the safe answer.
I agree with you, Dr. Makwakwa. And the other thing is, I feel even when we qualified with the 5.5, or I would make the assumption that the dentists qualifying now, very few would be equipped to start their own practice the very next day. So you do need to have this mentorship or someone having your back, someone where you can learn from, where you can get advice from in the beginning of your career.
Okay, I think this is the last question. It's pertaining conflict in the treatment plan between yourself as the owner of the business and your associate, and you both have different treatment plans. How do you handle such conflict?
In our practice, we have multiple case studies where we take a patient and we in a group of dentists and we discuss it, which is a fantastic way of learning. I think if you differ in opinion, you need to communicate it. I think that question was regarding the dentist works for someone else and him and his boss differs on opinion and the equipment is not adequate. I think you need to communicate that with your principal dentist or practice owner, your concerns. And I think whatever you do, you should never ethically compromise treatments or treatment plans because the patient also always needs to deserve the best. And then, just refuse to do it. That is what I would say. If you are put in a position where you are ethically compromised, don't put yourself ever in that position because you are ultimately responsible for the treatment that you do.
Yeah,
If I could,
shall I go first? Sorry.
yeah, you can.
I think it's important what you just said there, but always stay ethically. And I found over the last few years, and I know it's difficult financially out there for us and for the patients as our patients, and we are patients ourselves with medical doctors, etc. But you should never compromise on that. You should always give the patient all the correct treatment options from the top to the bottom, all the options. I always compare it to taking my car for service, and I'm on a service plan, and that specific service doesn't cover the brake pads for that service, and the guy sees it, but he doesn't tell me. That's totally unethical. So you need to tell the patient and not base your decision by looking on which option of which scheme he's on. So that option doesn't make provision for a crown or a bridge. You just give him an option of a partial denture instead of a bridge or implant. That's not ethical. You must give him everything from the top to the bottom. It's the patient's decision to make the final decision, and not keep it based on purely finances. Because the medical aids, unfortunately, it's not based on ethical principles, all of it. It's a financial decision, and that's why you get different options. So you must always remember that and give it to the patient. Thanks.
If I could just, sorry, if I could just add, I remember when back in dental school, when I was a student, we were always told, when you look at your patient and you're treating your patient, you would treat them as if they were your mother, your father, your sister, your brother. So how would you treat those people? Would you treat them with inadequate equipment, or treat them because you're afraid of the principal dentist and what he would say if you didn't follow what he said, and those types of things? I think that's what you should also think about when putting the patient first is the most important thing.
No, thanks. What I actually wanted to say is, very early on in your career, you must decide what type of practitioner you're going to be. Are you going to be an ethical one or not? And this is a difficult situation because you're referring to your boss. But I remember back in our days, there were some procedures which were not ethical. There are some procedures where people were claiming from medical aids and they were making more money. They were driving better cars, having better houses. But you need to put your foot down and say, I need longevity in this profession, so I will not do A, B, C, D, and E, even if you write it down. You write it down, and your patients will thank you for that. And in the long run, you're going to be a better practitioner and you'll sleep better at night.
And can I also add to that? And I think the way that you start your career, that is the way that you can have your career and end your career. So if you start by learning bad habits or seeing things that is unethical and other people get away with it, and you think you can do that as well, that is how you will live your career. And I think we want to be proud of what we do and want to be proud of how we manage and run our practices. And believe me when I tell you, if you do it the right way and the ethical way, it pays. Well, I'm not talking just about money. It pays in job satisfaction. You set an example for staff. Your patients definitely see the credibility and the integrity of a good practice. And you will have patients that will follow and be loyal to you for years to come, purely because of the principles, which is transparent. People cannot be fooled easily. Patients can't be fooled, neither can you earn respect from fellow colleagues or younger dentists if you do things not the right way.
No, absolutely. We have 4 minutes left. Any closing remarks?
Dr. Bellini, that specific slide that you asked me about last week to deliver what we should look for in a software program. Casey also should get a slide. I think Norma's got the slide. If you want to put it up, we can quickly run through it. It shouldn't take too long. I'm not going to give a whole lecture on it again.
Cool. I'll request Norma. Norma, please put it up for us. Thank you.
Okay, there it is. I'll quickly go through it. Like I said, I've been on this program for about 25 years, helped them to develop this. And this is basically the main things how to run your business if you've got all this in place. And really, I know about 75% of dentists out there are still relying heavily on medical aids, unfortunately, but that's a fact. So if you do it right, make it easy for yourself. And if you've got the right program, it's very easy, I can promise you. I can just tell you that a few years ago, I spoke to two of the big dental administrators. And for instance, they said that the average claims after a patient was seen in a dental practice takes about 4 to 7 days before getting processed at that stage, the average one. My practice was 4 hours. 4 hours, only 4 hours. So that means my money came in easier because I'm hitting all the payment runs every week of all the schemes. So it improves your cash flow. So there's a few of the main points, like web-based. So you can enter your program anywhere, anytime. Even if I'm lying on the beach in Mauritius, I can enter my program and my data. Any device, you can take it with you and enter. Easy to use. And this one guides you step by step. It actually shows you what the next step is. Paperless capability is we're going that way. We're moving away from files. Fully integrated diary. You put the diary next to your chair and you should be able to enter everything per patient on that diary on a daily basis, the x-rays, the history, the dependence from the main member, etc. Dental treatment plans, the program should provide that for you, the options. Electronic medical records should be there. There's also electronic remittance advices these days. Most schemes are downloading the remittance advice directly into your system, so you don't need your lady to sit there like 20, 30 years ago with a ruler and a pencil and tick off every payment. It's going directly into your bank account. So that sorts out a lot of problems. Customer clinical templates are available on this program. Online bookings, you can actually link this integrated into your website. So patients can go onto your website, make their own bookings directly on the software program. What I do is I normally would leave like 3-4 spaces open every day for emergencies so that the patients don't overbook my book via the online bookings. But this makes it very difficult, very easy for the patients to do it. There's patient portals where they can reach and there's also medical aid portals. And this is very important. You can get all the information you need from the different medical scheme portals. Like Bestmed even has a chat box. You can immediately online live chat to someone, and I must say it's very effective. They can immediately tell you, listen, you can do that procedure. You can't do that procedure because it's been done 6 months ago by someone else. Because I think most of you have picked it up by now that there are a lot of time rules involved with a lot of with fillings, for instance. You can only do it in 365 days, etc. So it sorts out that kind of thing where you're not doing those procedures in vain, so because you're not going to get paid. Well, and it's all about also informed consent. Very important that you can tell the patient there and then, listen, you need this filling, but your scheme has just rejected that now, real time. It's rejected. We're going to do it. You're going to have to pay. Is that fine? And it sorts out that the whole issue of informed consent, which is so important. Informed consent is not only about clinical informed consent, it's about financial informed consent as well. And then invoice directly from the diary interface. I explained that last week in my lecture. What we do is we do the billing while the patient's in the chair. So by the time the patient is finished, the bill, we've already sent it through to via the EDI to the scheme and to the front desk. And if it's real time, it will indicate already what is being rejected or accepted. So you can immediately again tell the patient, listen, you're going to be responsible for this. The rest was accepted, but you're going to have to pay this. And most patients are quite happy to pay there and then. And, it's much easier to take the money there than try and get it out of the patient afterwards. Credit control and financial reporting. And in fact, all the reports. I mean, if your software can't give you a proper printout of all reports, I print it out. I still work on hard copies. I'm very old school. But like the procedure analysis we spoke earlier, I print it out. I take every dentist that worked for me, discuss their procedure analysis with them, and say, listen, okay, you've done this, you've done that. And like I said, that's good dentistry. For instance, code 8553, occlusal adjustment. I mean, if you go a whole month through, you've seen like 200 patients, and you've done not one occlusal adjustment, I can promise you, you've done bad dentistry. It's almost impossible in a practice like mine with patients with so many implants, and implants fail because of occlusal adjustment not being done. You know, crown to eye, the implant will fail. You can speak to the ombudsman. I think he will tell you the same story. So this is a type of thing where your software program can indicate and help you to run your practice effectively and make sure that you're not billing in vain. And then things like dental lab management, like I said, real-time online claims, real-time processing. And yes, that's just a few highlights. This is actually probably a course that will take a whole week, but it is available online to look at it. And yes, that's just my little bit, Dr. Buleni.
Absolutely, that is amazing. I'm also on GoodX. I've been on GoodX for the past 10 years, but I don't think I've fully utilized all the platforms you're talking about here. So I need a refresher course myself. Do they provide CPD points?
Yes, I do.
Why don't I just get my CPD points as well?
Yeah, there's quite a few courses, and each of them take you get about 2 or 3 CPD points if you do that. So
absolutely. No, thank you so much. Thank you, colleagues, for joining us. Yeah, we are done. Am I closing anybody out to say anything, or can I close the meeting?
I think for me, it's just to motivate, you know, because I think codes are important, self-care is important, mental health is important. What you say to yourself is very important. So the only thing I want to say is that you need to occupy the space. There is nobody else like you. So I'll say a quote by Maxine Waters. It says, everyone has a part to play. We have the power. You can do it. Thank you.
Absolutely. Thank you so much. Dr. Yanel?
Yeah, thank you very much. I really enjoyed it, and thank you for inviting me. I just want to leave everyone with a last note that when you are a young dentist, sit down and think, have a strategy, have a vision and a mission of what you want to do and who you are, and then also have a set of values that serves the patient. If you have that all in place, then you've got it a good start.
Absolutely. Dr. Meyer?
May I agree with her, saying that I had a broker when I started, and he said, you shave yourself in the morning. The ladies won't do that, but what he meant by that, you look yourself in the face in the mirror, and you must be happy with yourself. Do dentistry so that you can be happy with yourself.
Amen. I think that was a good closing. Thank you so much, colleagues. It's a good night. We'll see you at the Congress. Hope you all registered. Then we'll mingle there, and then we can have more mentee, mentors, relationships that are going to begin from there. Thank you so much. Good evening.
Thank you, everybody.
Thank you.
Thanks once again. Bye.